Hello and welcome to the program. I'm Layo Adegoke. Nigeria has recorded its first COVID-19 fatality in the nation's capital, Abuja. The Nigeria Center for Disease Control, NCDC, says the victim was a 67-year-old man who had underlying medical conditions, multiple myeloma and diabetes, and was undergoing chemotherapy. The family of the victim had told Channels Television that he died of COVID-19 on Sunday, and that's a few days after he arrived in Nigeria from the UK. They said he was in self-isolation upon his return from the UK and personally called NCDC after experiencing some discomforts that are related to COVID-19 symptoms. He later tested positive and was promptly evacuated to the specialist hospital where he died while receiving treatment. A representative of the family, Abubakar Achimugu, speaks to us on how the family is handling the situation.
He was outside of the country for just 2 weeks, for very personal reasons, and he got back on the 10th of this month, March. But he was at the airport, after all the usual checkup or checking of the medicals. That since the temperature was okay, that he could still take extra precautions by self-isolation exactly for 14 days. And that was exactly what he did when he got back home. And I think a few days, like about a week into that self-isolation, he started noticing some symptoms, that were unusual and that were semblance of the symptoms that is being publicized on COVID-19. So he called them personally, that he called the NCDC to come to visit and see, contrary test, since he was experiencing symptoms that were alien to him. And I think after the test, the day after the results were made available, which came out positive, that was on Saturday, and then they arranged that he be evacuated to the COVID center here in Abuja. They were prompt and getting the ambulance. I think everything was on time. And what we will always be, and as Muslims, we believe that everything happened, according to how the Almighty Allah had dictated.
Meanwhile, the Nigeria Center for Disease Control, NCDC, has confirmed 5 new COVID-19 cases in the country. 2 of the cases are in the nation's capital, Abuja, 2 in Lagos State and 1 in Edo State. The NCDC says 2 of the cases are returning travelers from the UK. With the 5 new cases, the number of confirmed cases in Nigeria now stands at 36, of which 33 of them are active, while 2 have already been discharged and 1 confirmed dead. A further breakdown shows that Lagos State now has 24 cases, Federal Capital Territory Abuja with 6, Ogun State with 2, Edo, Ekiti and Oyo states have 1 case each. Let's discuss further on the spread of COVID-19 in Nigeria. We have joining us now Yinka Oyeniji, an African Affairs Analyst. Thank you so much for speaking to us.
All right, good afternoon.
Good afternoon. Nigeria now has recorded the first death, and the number of cases keeps increasing even though state governments have put in place measures to curtail the spread. There is always more to be done, but what could be practical at this time?
All right. I don't believe that many state governments have worked according to what can be done in the circumstances. All right. We seem to think that it was never going to get to us, and that's due to lack of information management. In United Kingdom, the Prime Minister addresses the public on a daily basis. So the lack of information is part of the biggest problem we have right now in containing coronavirus in Nigeria. And when we have disease outbreak and all of that, there are different stages of deployment of solutions, okay? So right now, we don't even say that we have traced all those who probably could be primary sources of coronavirus in Nigeria. We don't have data to be able to track them down, and then also to supply whatever information is required for different phases. In United Kingdom, in United States, and all other countries, they've moved from, they have the disease, they've moved to containment. They are able to identify those who have it right now, and then able to contain them wherever they are, to talk about isolation or social distances. Unfortunately, we are yet to be able to grasp with managing information properly and data. That's where we need to begin from right now.
Yeah, and this outbreak, it continues to take its toll in Africa. But what do you say about some people who still don't believe the coronavirus is real, even with the number of increased cases and deaths?
I don't think that people don't believe that it is existent. They know it is existent. We just seem to think that it is either God will help us divinely somehow and it will go away without attacking it. All right, so there are practical solutions that we should start putting in place right now. We need to improve our medical infrastructure. Learn from China. By the second week of fatalities in China, they started to build hospitals on a daily basis. They started converting public places to medical institutions in order to treat people and contain this spread, up until we start something as graphic as that. For example, how many test machine kits do we have per local government? How many of our primary healthcare centers have been converted to health facilities in order to be able to test this disease? Up until government takes that first step to do that, then we are not ready. We were forcing the President of the Federal Republic to address his own citizens. That's interesting to note. Whereas in other countries it's become a national disaster, we are yet to do that in Nigeria. So these are the government needs to take the initiative. All the tiers of government, from local government to the federal government level, we need to start being on critical crisis management mode from like yesterday.
Yeah, and I'm sure everyone is on their toes for this. And no doubt this virus, it's greatly affecting a lot of things in the world and in Africa. But how can, Africa, the continent, mitigate the impact of this virus on, economy, on everything?
So this is where we are. And like a month or two ago, we have been talking about economic stimulus. We have been talking about bailout funds and all of that. Now, first of all, we will need to get to the point where we are going to shut down the countries. Countries are going to be on lockdown. If we don't do that by next week, then the spread may be in the thousands. So each country has to shut down its airspace and, of course, land borders. Unfortunately for Nigeria, we have porous border management systems. We are talking about Cameroon, Cross River States, Niger, and talking about Kebbi State and all of that. All our land borders, we need to deploy law enforcement agencies, including the military, to man our borders. No going in, no coming out. First step, lockdown. Step number two, then we need to start. I don't know why we close down our tertiary institutions who are supposed to be the epitome of knowledge creation and distribution. We need to find some kind of cure locally for coronavirus, even in Africa. And then we can start talking about the effects of containment, because if you want to keep people at home for 2 weeks, then you must ensure that those people have adequate social stability, infrastructure, food, circulation and distribution to keep them home for that long. Until we do that, we are not ready to tackle this virus.
All right, thank you so much, Yinka Oyeniji. As time goes on, we pray that this virus is brought under control. Thank you so much for speaking to us, African Affairs Analyst Yinka Oyeniji.
Thank you for having me.
Well, Ghana has reported 3 new cases of coronavirus, bringing to 24 the total number of confirmed infections in the country. The patients include 17 Ghanaians and foreign nationals from Norway, China, France, and the UK. They are in isolation and receiving treatment. The country's only confirmed death was a Lebanese patient who died on Saturday. He had an underlying health condition. President Nana Akufo-Addo on Saturday announced that the country would shut all its borders starting midnight on Sunday to curb the spread of the virus. Well, Zimbabwe has also recorded its first coronavirus death after a patient who was admitted at Wilkins Hospital in Harare died on Monday morning. Health and Child Care Ministry Permanent Secretary Dr. Agnes Mvoma confirmed the development this afternoon. Our Zimbabwean journalist Nigel Yamutumbu, he tells us more on this story.
The coronavirus is improving, the World Organization's Africa director has said.
Is that one of the confirmed cases of the deadly COVID-19 virus, he has died. This particular said development comes amidst reports, conflicting reports between those that have been published by the government of Zimbabwe and what has been brought out into the public domain by the country's main opposition political party, the Movement for Democratic Change, which controls the country's metropolitan cities, including the capital, Harare. The government of Zimbabwe says that the country has 2 confirmed cases, one in Victoria Falls and another one in Harare, while the opposition claims that there is an additional case in Harare, bringing to 3 the number of those that have been affected. As of now, it is reported that the person that has succumbed to this deadly virus is a broadcaster, a well-known broadcaster in the country who over the last weeks had traveled to the United States and had a pre-existing condition which has led to his untimely departure. Details of which will be confirmed once it has been officially pronounced. But as of now, what is clear is that indeed the COVID virus is prevalent in the country, in Harare, in Zimbabwe, and the government's measures that they've put in place, first declaring it a national disaster, and also suspending all public gatherings, including that they had planned independence celebrations on the 18th of April, the Zimbabwe International Trade Fair, which the country hosts annually in the second capital of the country. And they've also suspended all gatherings that include more than 100 people, amongst other host of measures, including compulsory testing at all government and public areas of that is of temperature and so forth. So yes, it is confirmed that we have a death case here in Zimbabwe, details of which will follow.
The distribution of the first batch of medical equipment donated by Chinese billionaire Jack Ma to help fight coronavirus in Africa is expected to begin today. The consignment arrived in Ethiopia on Sunday evening. Prime Minister Abiy Ahmed confirmed the arrival of the first wave in the capital Addis Ababa, which includes 1.1 million testing kits, 6 million face masks, and 60,000 protective suits. The number of known infections in Africa lags behind most other continents, as more than 1,000 cases have been confirmed by the Center for Disease Control.
It's a huge threat for Africa. Not even a threat, it's a looming disaster for Africa. We have to be very clear and take this seriously. We have to win the battle against COVID in Africa, because it's going to be devastating in the humanitarian side, in the economic side, and our security side. So this is a serious challenge for the continent.